Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about spinal cord stimulator implants. A spinal cord stimulator is a revolutionary device that's permanently implanted around the spinal cord in an effort to provide pain relief to those with chronic pain. These days it works well for either chronic back or leg pain, and a spinal cord stimulator is considered a last resort treatment because it involves a surgical procedure, it's very expensive, and it doesn't fix the problem, but it masks pain. And just to clarify, it's very expensive for the insurance company. It's usually covered and the patient's not responsible. Now, who benefits from a spinal cord stimulator? It's not a first-line treatment. It doesn't fix a chronic pain problem. It's an excellent last resort option for those who have failed back or neck surgery syndrome, post-laminectomy syndrome, RSD or CRPS, diabetic or peripheral neuropathy, testicular, pelvic, abdominal pain, and there are new indications coming out all the time. Now, what can a spinal cord stimulator do for chronic pain? It can take a person with chronic pain, depression, and inability to work and completely turn that person's life around. It's been shown to work well now for back, neck, arm, and or leg pain. The patient does need to have a trial implant placed first, which is a low-risk procedure. It's an excellent last resort option when surgery is no longer indicated, and it can decrease the need for narcotics. Now, the first step is to get a trial implant. It's percutaneously placed with two tiny leads that are then run outside the skin to a programming device / battery. It's placed under sedation because the pain doctor will need to ask the patient, okay, I have these leads in place and they're activated. Does that cover the area of where you're having your pain? And then it's stitched into place. It's worn about a week to see if it's going to work. If you do get over half, 50% pain relief, then it's deemed you can go on to a final implant and you'll have to undergo a psychological evaluation first. How is the final spinal cord stimulator implanted? Well, it's completely under the skin. It takes about an hour. It consists of a large paddle lead for better coverage. I'll show you one in a moment. Doctor makes an incision and small bony removal to get the paddle lead up around the spinal cord. And then the leads are tunneled through the soft tissue subcutaneously above the buttock area and plugged in to the battery pack, which is also the programming device. There's over 200 programming options available with the latest spinal cord stimulators. The new ones are rechargeable through the skin. And the new ones also don't lose coverage as a person goes from a sitting to a laying or standing position. How well do they work? There have been quite a few studies done on the effectiveness of spinal cord stimulator implants. Before we talk about that, this is what you can see as a paddle, a lead paddle, okay? There's a lot of silicone diodes here, and they can help with the programming options. The latest batteries and programming units are not too much bigger than a quarter. It's amazing, right, how small they are? Now, a St. Jude's study years ago showed 84% had life greatly improved. Another one showed 77% good to excellent pain relief. For diabetic neuropathy, 85% experienced substantial sensation recovery, and over 3/4 have significant pain relief. So with neuropathy, you're getting pain relief and sensory restored. For RSD, spinal cord stimulator implants work extremely well for relieving pain. Okay, so quite a few indications for what they can do for patients. What are the risks? Well, one risk is that the device will stop working. Another is there's an incidence of migration of the leads, maybe infection, bleeding, or a wound breakdown. The top non-operative Georgia pain management is through the Georgia Pain Network. There are several clinics throughout the state, over 10 in fact, accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.